Hey guys, welcome back to the show. Today's episode is amazing. It's on stem cells and it's all about the potential of stem cells. So this is going to be a doozy. So let's now get into the episode. Did you know that stem cell therapy can be used as a preventative measure? In this episode of the Biohacking Superhuman Performance podcast, I chat with Dr. Joy Kong about stem cell therapy. So many people think of stem cells as a regenerative method, and it is truly amazing for regeneration. But what about prevention? Stem cell therapy is a medical procedure that involves the use of stem cells to prevent various diseases and conditions. Stem cells are unique cells that can differentiate into different types of cells in the body and can also self-renew to produce more stem cells. Dr. Kong explains the different sources of stem cells they can pull from, such as the bone marrow, fat tissue, and even from birth tissues. Depending on where the stem cells are sourced from, each source of stem cells has its advantages and disadvantages. We also chat about how stem cells differentiate from exosomes, the future of stem cell therapy, and what the research is saying about stem cell therapy for autism. Joy Kong MD is a UCLA-trained triple board certified physician. She's the president of Uplift Longevity Center in Los Angeles, California, where she specializes in stem cell therapy and ketamine therapy, as well as a wide range of therapeutic modalities to improve patients' overall health by enhancing their body's innate regenerative potentials. I met Dr. Kong at A4M last December, and we just hit it off right away. She's just so incredibly knowledgeable. She's so generous with her time and her information. She's a real pleasure. Dr. Kong is the founder of the American Academy of Integrative Cell Therapy, which is www.aaict.org, where she provides training to physicians on stem cell therapy. Dr. Kong also conducts clinical research on stem cell therapy and is a published author in scientific journals. So this woman knows of what she speaks. To find Dr. Kong, MD, you can go to her website, which is joykongmd.com. She also has made beautiful skincare products, which you can find at charaomni.com. So that's Chara, CHARAOMNI.com. She has a great YouTube channel. So just go searching Joy Kong MD on YouTube, and on Instagram, she's Dr._Joy_Kong, and she puts up great content on Instagram as well. Thank you for making it this far. Thank you for being here with me and for listening to the podcast. Make sure to leave us a review. Make sure to share this episode with friends, family, anybody who you think would get value from it. And without another second delay, let's jump in.
Hey folks, just a quick reminder that all of the information presented in this podcast is for information purposes only. No medical advice, no diagnosing, no treatments suggested here. Before you try anything that you hear about or learn about here, make sure that you check with your medical provider.
Dr. Joy Kong, welcome to the show. It is such a pleasure to have you here today.
Thank you so much, Natalie. It's my pleasure.
Yeah, well, I was. Where did we meet? We met at A4M.
Austin.
Was it Austin the first? Oh, that's right. It was Austin at How Do You Health. And then we met again at A4M, like,
yes.
What was it, like a week or two later? It was like, oh yes. My God. So anyway, it was really great. It's always like the beauty of these conferences. And I've said this often, like I don't spend nearly as much time as I would like sometimes in the sessions, because I end up spending all my time networking kind of in the exhibit halls and with the docs. And, they're just amazing events to connect with people. And I think at A4M, it was Suzanne Turner who kind of said, hey, do you guys know each other? And we're like, as a matter of fact, yes. So anyway, Joy, why don't you tell the audience a little bit? I mean, I'll have done my intro already by now, but, maybe tell us a little bit about where you're at in your business. Like, you're in this incredible growth area of stem cell therapies, and how did you get here, and what kind of how long have you been doing this physical renewal through stem cell business kind of thing?
Yeah. So I started out as a psychiatrist. So I went to UCLA and I chose psychiatry because I was fascinated by the brain. But pretty soon, well, after 7 years, I did realize that there were a lot that could be done for people that were completely ignored. So much of the brain's health could be traced back to what's going on in the body and different organs, and that was not looked at all. So coming from a culture, I grew up in China, from a culture that really stressed a holistic approach to health, which means that you look at the body as a whole, that every part can affect the other parts, that
Yeah.
we're not just, floating heads and floating, organs.
Limbs.
Yeah, exactly. We
Yeah.
are a whole. So that kind of made me, I was drawn to integrated medicine. And then I discovered anti-aging medicine, where stem cells is part of anti-aging medicine. So that was perfect because I can't imagine anything more holistic than stem cells, because that's what made us, right? The cell ended up creating who we are, this complex being, and how can we tap into the intelligence of those cells? So what looks really incredible on paper happens to be producing incredible results in real life. And that's what's really exciting, seeing patients getting better. I first meeting doctors who have treated other people and showing me the results. The first case was an autistic kid. And as a psychiatrist, I avoided dealing with autism because it was a frustrating and unrewarding type of illness, because we just didn't have good tools. And to see how stem cells were able to make such difference for these kids, that was really exciting. And then it just went on from there, hearing about people's, getting such tremendous results from their autoimmune diseases, from their, muscular skeletal injuries, brain conditions. So, and that just led me onto a path of self-learning, because there's really no good textbooks. There's no good courses. So I just read articles after articles. You learn from scientists who are studying this, who are investigating, the cutting edge. So then that's how I learned everything, is through article by article. And yeah, eventually, creating our own products, because I believed from all my investigation, looking at benefits of using different sources of stem cells. And I do believe, we can talk about this later, that birth tissue derived stem cells is a superior source to fat derived or bone marrow derived stem cells. And among the birth tissue, because there's the tissue has different components, right? There's umbilical cord blood, cord tissue, amniotic membrane, placenta. So they all are a little different.
Yeah.
So I created a product that combined different compartments and put them all into one. So you're harnessing the different healing properties of various components. And so that's also part of what my company does, which is to provide these type of holistic or comprehensive products. And then I developed skin cream, Chara Omni, which is really fun. And I set up an academy to train other doctors. So it just kind of went on from there. Yeah.
Yeah. No, that's amazing. I think ultimately, like what you're describing is the journey of a physician who's at the forefront of new technology, right? So you're breaking ground. And what's so amazing about you and other doctors like you that I met at A4M is that you're not just kind of, I mean, you kind of need a community around you to kind of learn from and collaborate with as everybody's kind of building on everybody else's findings and knowledge. And so, the fact that you've launched an academy and you're training other people, and like, I just think that's just so inspiring, right? Because so often we talk about medicine, and it's certainly in this space, which is more of the functional space and even the biohacking space, and it's with a lot of disappointment, right? Because conventional medicine, it's not designed to deal with a lot of the most serious things that we're faced with, and those doctors are not necessarily trained. What we're seeing is a lot of conventional doctors breaking away from the allopathic model. saying, just
Yeah,
like you did, really,
yeah.
saying like, this isn't working. I'm not getting anywhere. There's got to be a better way to help people.
Exactly. It
And
comes
here
from
you are.
frustration. Either
Yeah.
frustration for their inability to make a fundamental change in their patients' lives, or frustration because they got sick themselves or their family members got
Yeah.
sick and they did everything they could listening to the conventional doctors and nothing was improved.
Yeah.
They didn't get very far. And then they realize, oh, there are other people who are doing these very different things and they're actually getting better, and they tried it themselves. And then the conclusion is, God, why didn't they teach us
Yeah.
all this in medical school? So that's how this whole branch broke off, and eventually that's going to become the mainstream.
I
Not
hope
that
so.
traditional medicine have nothing good to say. I mean, there are a lot of wonderful things, especially acute care, the surgeries and the urgent, when there's more acute needs, infections. But really when it comes to chronic conditions, which is usually very complex, to think that we can just use a big hammer,
Yeah.
just hit one thing and then we're going to fix it all. That's really, really naive. It's childish.
Yeah. Yeah. Well, and to some degree also, even we could prevent a lot of these things from happening, right? With a more holistic model. And it's interesting that you grew up in China and it's funny, I saw one of your social media posts this week because I think you were sick and there was a picture of like 2 little black pellets in the palm of your hand
Yes.
and I mean, I've dipped into TCM myself at times in my health journey myself. And I laughed because I'm like, I've often said to people, you get handed either like a bag of herbs or these little black pellets by your TCM doctor and just get told, take this 3 times a day, take 9 pellets, and you're like, you have no idea what's in there, like none. All you know is that you're going to feel better and it's going to be okay. But in traditional Chinese medicine, to your point, like they're looking at your energy and they're taking your pulses. And I once there the clinic where I was going, they brought in a master from China and he didn't speak a word of English. And so, and so I was trotted in and sat down in a chair, and this guy he took my pulses, he looked at my tongue, he poked my legs, and he turned to the doctor that I normally see, and he said something to her in Chinese, and I'm like, what did he say? And she said, he asked if you're always like this.
Oh.
The next thing you know, I'm out the door with a couple of bottles of these little black pellets and and teas and whatnot. So anyway, it's very interesting, but I've always believed that whether it's traditional Chinese medicine, which is like thousands of years of learning, right? Or Ayurvedic medicine, which is like kind of another branch similar to TCM, that if we could bring those together with, allopathic medicine, you could end up with like this incredible, much more complete model. Right. So, but
Yeah.
anyway, but now you've gone off into a whole other direction, which is stem cells, which takes us to a whole different world. So I want to ask you a million questions about how do stem cells help with autism and brain injuries and all the things. But before we do that, let's bring the audience along and just talk about stem cells in general, right? And how, even from an aging perspective, before we even get to the disease model, like, what's the role that stem cells play in aging? And, obviously we produce them out of our bone marrow, but maybe you just want to talk a little bit about if as a young children, we have access to regeneration and repair in a way that we don't as we age. What happens? Where do the stem cells go?
Yeah. So first of all, I think, people don't realize that stem cells, this is not a homogeneous population.
Right.
We have, every stage of the evolution possible, of stem cells. They're all stem cells, but there are tissue specific stem cells, like your liver will have liver stem cells.
Yeah.
And then there are intermediate stages, and there are pluripotent stem cells, which can develop into, any organ of the body. So the intermediate will be something like mesenchymal stem cell, that are all along your blood vessel. Anywhere you have blood vessels, you will have these mesenchymal stem cells. So there's this hierarchy of different type of stem cells, but mesenchymal stem cells is probably the most well known right now and the most sought after because they have such a powerful kind of a coordinating effect of regeneration. So just imagine these cells have been with you your whole life, and they're all along your blood vessels. Anywhere you have blood vessels, you will have these, before they turn into mesenchymal stem cell, they're called pericytes. So peri is all around. So they're around the blood vessels. As we get older, the number drops sharply. So when we were born, every 1 in 10,000 cells is a mesenchymal stem cell. But by the time we reach our teenage years, it becomes 1 in 100,000. So that's tenfold less. And then when we reach our 40s, becomes 1 in 40,000. And when we reach our, 400,000. And when we reach our 80s, is 1 in 2 million. So you are literally running out of these signals. These cells are there to detect what's going on in your blood, what's going on in your local tissue, and to see what needs to be, what information needs to be sent out to bring about regeneration. So if you just don't have enough of these workers, lining up your blood vessels, you don't have the signals. You don't have enough signals to regenerate. That's why, people say, oh yeah, my knees, of course, is bad because I use it so much. I climbed, skied, this and that. No, that's not the key. It doesn't matter. Just think about when you were a teenager, when you were, 20s, you can abuse your body, to a much greater degree. But because your body have enough stem cells, have the right signals, it just repairs right up. You're not going to have this lingering pain and swelling and, immobility for years. Just it doesn't happen. So it's about the signals. And so there's an attrition rate, and there are all kinds of reasons. First of all, when cells live in a toxic environment, they can be killed. I mean, there's damaging to them. So as we live, our body becomes less and less hospitable, right? More hostile, so more inflammatory. Then you may have more cell death, and the oxidative damages that damage the DNA, damages the cell structure, damage mitochondria. So cells just run out of gas, run out of the ability to stay vibrant, and they senesce. So when they fight your battles, they can also die. Once they're activated, they don't live forever. Bone marrow produce certain types of stem cells, very, very, very small amount of mesenchymal stem cells, a little bit more of the hematopoietic progenitor cells, and then they produce a lot of mononuclear cells, which are immature immune cells. So that's, we used to think that bone marrow is the only place where we still find stem cells. And now we know it's everywhere. It's literally everywhere in your body, in all your organs. So we have the capability to regenerate, but we just need to give the body the right signals. And that's where stem cell therapy comes, is that we're replenishing the signals that may have been lost.
Interesting. So when people are going in for stem cell therapy and they're having stem cells harvested from their bone marrow and from their fat tissue, can we talk about those a little bit? Because you just said about the bone marrow, like there's very few of those stem cells that you really need, certainly as an older adult. But what about, and I can't imagine that adipose tissue is any better.
Well, when they say adipose tissue,
there's so much inflammation in fat, right? So like,
so just to give you an idea, if you just look at the amount of mesenchymal stem cells in comparison to total number of cells in the bone marrow, it's between 0.1 to 0.01% that are actually mesenchymal stem cells. And
those are the ones we're after.
Yeah, but when you look at fat, it can get to 20%. It's not because of the fat, it's because the blood vessels that are coursing through the fat are supplying the fat cells. So you're getting cells off those blood vessels. So you do have more mesenchymal stem cells.
Oh, interesting. Okay. I wouldn't have guessed that. Okay. That's really interesting. So you're going to get more from fat. And yet we were talking before the podcast, you were saying that, autologous stem cells, like using your own, is never going to be as good as using cord blood or, other stem cells that come from from a new baby, not the baby itself, but from whether it's cord blood or placenta or amniotic material. So maybe you want to talk about that. Like there's these different sources of stem cells, right?
Yeah, and I actually have a lecture online on YouTube. It's called Are All MSCs Created Equal? So I actually go through analysis of literature, just what has been studied, just comparing their potency, their ability to differentiate, their anti-inflammatory capabilities, their neuroprotective capabilities, and look at even at potential to cause cancer. Actually, your own stem cells have a much more higher potential to exacerbate existing cancer than earlier young stem cells like from the birth tissue. So, it's there's not enough direct comparison of, let's say we have, all these people, we do a, controlled study, this group is going to have their own cells, the other group is birth tissue cells. We don't have those studies. So it's hard to say, but you can look at just the different studies. There are some studies. The ones I looked at and I presented is a direct comparison. So if you look at how fast they senesce, how many generations they have left, their telomere length, everything, the birth tissue, the younger cells are superior.
Well,
and when you
makes
look
sense,
at how,
right? Yeah.
and when you look at how the cells function in the body, it's really because of these capabilities, these abilities to be anti-inflammatory, to produce different growth factors, and to, basically their activity level. And of course, how long they last, they're able to sustain themselves. So if you look at the fact that the cells that's what they're doing, really. They're not there to become your own cells. That's a tiny fraction, maybe 2 to 5%, no more than 2 to 5% of the cells actually stay in your body. They are, they're like, they go in, they do their battle, and they're gone. They die. So very few actually stay in your body. So don't think, oh, I'm getting cells from somebody else, that these cells are all going to stay in your body. The consensus probably no more than 2 to 5% actually stay. But do they do a hell of a job when they're there? Yes, because I've seen incredible things, not just from me, but from the doctors I work with and from all the research studies. So they do incredible things, but most of them will die. So the key is the incredible things they do does not come from them becoming part of your tissue, them becoming part of you, right? They go in there, they send their signals, they orchestrate the right repair activities, and then they go away. Yeah. So if you're counting on their activity level, then yes, I've just shown you that these younger cells are more potent and more active. So then you can kind of infer that these are going to be superior.
Right. So yeah, because my understanding is, and I mean, it's come along, I keep reading things and obviously I don't have time to, I don't always deep dive into stuff, but one of the things that I've heard is what you just said. Basically, it's not the actual stem cell doing the work. It's all the growth factors. It's all the chemical messengers that they're emitting that initiates, like, kind of gets the body doing what it's going to do. Like, for example, in a joint, where we're trying to repair cartilage or whatever the case may be, it's, because then people talk about, and maybe you can clarify this, people talk about providing scaffolding for the stem cells so that, so then when people start talking about scaffolding for stem cells, then you start imagining that, oh, they're creating like this, whatever the scaffolding is, and the stem cells are going to anchor to it and they're going to stay there. But to your point, the stem cells don't stay there, but
a very small minority.
Right. Yeah.
They may stay. So we have seen, cells do stay in the recipient, including human cells stay on animals' body. So it does happen, but that's not the main way they exert their benefits.
Right. And then how does that compare, for example, because right now, I mean, I guess we're sort of talking about, let's say we're talking about repairing a knee or a hip. And there's also a school where we're using, let's say, peptides, like injecting some kind of like an analog of growth hormone, like an AOD 9604 with hyaluronic acid, which I think we're getting into that world of combining different things. And people are getting, or BPC 157 even, people are getting reasonably good results. I don't know that they're getting the same degree of repair as you would get with stem cells, but do you have insight into, like, how those are different, or maybe are there different situation where you would favor one over the other?
Well, I almost liken this to, a one chemical versus a whole herb, right? So you can extract one single thing like BPC 157, powerful. This is an incredible molecule, but it's one molecule. We don't know how many hundreds of thousands of molecules one stem cell is going to secrete and
Right.
how they all going to work together.
Right. So it's almost like a less holistic approach.
Yes. Doesn't
Right?
mean it won't work, doesn't mean it's not powerful,
Yeah.
but you're gonna get a lot of repair going on with the cells.
Right. And so you mentioned inflammation before, and I've heard people say that if you don't calm the inflammation in the area before you bring in the stem cells, or even frankly anything else, you're never going to really get the results, because the analogy is like you're sending your workers into a burning building. They're just not going to be able to, or they're not going to be able to do as good a job as they would if there wasn't a fire. And yet on the other hand, we talk about anti-inflammatory effects of these things.
Yeah.
So
So what they're
what's your
saying
take
is
on that?
partially true. Yeah. So for example, in certain situations, you wouldn't want to put stem cells right into a location right after the incident. That will be in the case of a heart attack, a stroke, or even a very acute injuries, because what happens is when you have a very acute injury, the environment is very toxic. So within the first 48 hours or so, it's a toxic soup. There's so much going on. All these, calcium leaked out of the cells. There's just it's very, very damaging environment. That may not be the best time to put the cells right in that location. But then we talk about chronic inflammation.
Right.
So a lot of inflammation in the body, what they found out through research was that actually elevated level of inflammation make these cells work better and harder. So I used to think, oh, we need to calm your inflammation first. So, we want to reduce inflammation. But guess what? We can use the inflammation you have to wake up these cells, make them more alert and work more effectively. So yeah, so no longer would I say, let's calm your inflammation first. No, let's go at it. Let's calm the inflammation using these cells.
As long as you're not in that highly acute phase kind of
Right,
thing.
exactly.
Okay, well, that makes sense. Now, what about where do exosomes fit into all this?
Exosomes,
talk about
I
that?
think yes, I do.
Okay.
I actually have a video on YouTube called Stem Cells versus Exosomes, because I do have a lot of thoughts in this. So exosomes, very exciting. A lot of hype around it.
Yeah.
First of all, it is a good it's a good way to sell products, saying, hey, we are not dealing with cells, so we're not under the same kind of scrutiny from the FDA. That's really how a lot of this, how it was started. Are they helpful? Yes. Can they replace cells? No. Nothing can replace life itself. You can get all the secretion product you want out of the cells, but guess who made these products? And guess what the cell will do? If the cell's in a different environment, it's going to make a different set of exosomes. So you're producing the exosomes using one set of environment, and you give it to the body, and you're saying, okay, no matter what your condition is, this is this exosome. This is a set of exosomes that we're going to give you.
Yeah.
Instead of giving you stem cells, where the stem cells can say, oh, wow, you're a little, too high in this level of, inflammation, in this arena, from these cells. So let me send you the right set of exosomes. I'm going to produce all these particular, armamentum of growth factors, and this is what I'm going to give you. So that's a lot more targeted and intelligent approach. Do I like exosomes? I do. I still like them. I still use them because I like the fact that we're getting a lot of these little nanoparticles all at once. So there's a lot of, you can produce anti-inflammatory effects fast. and they also can cross the blood-brain barrier very easy.
Mhm.
But they cannot replace the intelligence that's embedded in the DNA of the cells, because that's how the cells can respond to the environment. And cells also secrete growth factors that it doesn't include in the exosome packets.
Right.
It can shoot out growth factors just into the extracellular fluid. It doesn't have to put it into the exosomes. And also, stem cells would do something that's really, really cool, which is called mitochondria transfer. So these young stem cells, of course, if you use your own, then you have your own, old tired, mitochondria, whatever level of mitochondria you have, that's what you have. But if we're getting it from the birth tissue, from these cells that are actually in between embryonic stem cells and the baby stem cells, they're more potent than the baby stem cells. So they have very fresh, young mitochondria. And when I give it to people, these mitochondria has been documented to be able to go across this cellular bridge, a microtubule, nanotubule bridge, walk across and get into your own cells. Like one study showed
Wow.
macrophages. So you're elevating the cellular energy of your own cells. So in a sense, you're reviving your own cells, right? You're breathing life into them. Um, they can do, they can just shoot off mitochondria into the space and be taken up by other cells. And there's all kinds of fun things going on the cellular level. So you're not going to get that with with exosomes.
Yeah,
So
no, that's so interesting, right? So the exosome is like saying, here, you can have a drill. And the guy's like, but I really need a saw. Or a hammer or whatever.
right,
I mean, the
right, there
drill's
are those
useful.
situations. Yeah,
Yeah,
there are
the
those
drill's useful,
situations.
but it might not be the only thing you need, or it might not be the exact thing that you
Yeah.
really need.
And
That's such a great point.
I'm also concerned about the fact that exosomes is somewhat blind, right? You're putting the mesenchymal stem cells in the culture. So there are a few ways of getting the exosome. Some are just, getting it from amniotic fluid, but a lot of the products we're getting on the market is, growing the mesenchymal stem cells in the culture and letting them secrete these exosomes. So you collect them. So these are just, they're signals, and they may promote growth, promote regeneration, but some of them may promote cancer. When you have stem cells that have the intelligence to detect cancer, you don't really have that extra backup
Yeah.
level of intelligence with exosomes. So I'm always a little cautious about that. Just like even when with your own stem cells, just because you have your own stem cells and they are mesenchymal stem cells, it doesn't make them fully intelligent, because I think they can go through what I call cellular dementia. So
Oh
they could get
no.
older and they could
Yeah.
lose their marbles, and they could look at a cancer cell and they're like, oh, you're a cell. So let me help you grow. Let me help you, regenerate. These are the things I secrete to make you help you grow. There you got, exacerbation of growth of cancer cells. That's why we have this, this concern about causing cancer growth. It's because your own cells have forgotten that this is a time that you need to recognize there's something really wrong with this cell, and you need to
Mm.
give them a different set of signals, such as the apoptotic signals,
Yeah.
which younger stem cells are really good at. They've
Right.
retained a lot of this intelligence that somehow got lost because your cells got older and tireder and more forgetful. So
That's really sad. It's kind of like, I love how we give personalities to cells, right? Somebody else I interviewed referred to senescent cells as grumpy old men, that just kind
oh,
of sit there and don't really do much and just grump and make everybody else around them grumpy. And it's like,
that's right. That's right.
yeah,
Make your life miserable. Yeah.
yeah.
If you're around me, you're going to be miserable.
Yeah, exactly. Exactly. So anyway, but I mean, that's just, that's new information for me. That's really interesting because it really tells us that in a way, going to the stem cell and using the stem cell, it's I mean, I talk about this a lot. It's how far up can you go in that chain of command so that you let the body do its like you're tapping into the body's own innate intelligence, right? We've yet to reproduce a human body that, or the repair mechanisms in a human body like that, as you recall it, that innate intelligence that somehow knows to do things. And so we could look really smart just by tapping into that and letting it roll. and not
Well,
trying to
yeah, that's how I feel when I'm
microcontrol.
doing, I've been doing stem cell therapy for 7 years and I feel really smart, but and I know it's not me, it's the cells. I'm like I'm the expert at knowing where to put the cells, but it's not me. It's their intelligence that's doing amazing things, and it's really fun. And I think that's where the future of medicine's going, that we're going to use incredible intelligence way beyond what our own brain can conjure up. We're going to utilize what created us to
Yeah.
help us. Yeah.
Yeah. Yeah. No, that's amazing. I love that. So, okay, well, that kind of gets rid of my question of how old is too old for people to use their own stem cells. I mean, you just kind of answered that. I mean, at some level, if you have the option, the stem cells from all these other sources are going to be your best bet, not your own fat or bone marrow. Is there ever a time when you would use fat or bone marrow? I mean, quite apart from the fact that it's
Well, there
also
are a lot of
ridiculously
people,
painful.
I don't want to take away from the doctors who are doing fat-derived or bone marrow-derived stem cells, and a lot of them have seen good results. But there is a risk, like the cancer-promoting risks, uh, especially if you're over the age of 50.
Yeah.
I think that's really just, looking at the risk versus benefit, I don't think is as worthwhile.
Mhm.
When you're younger, it may make more sense.
Yeah. And I'm sure you're looking at the health of the person and, how they've taken care of their body. I mean, different, two 40-year-olds could be two completely different
Oh yeah.
situations,
Yeah.
right?
So I'm talking about a healthy
Yeah.
40-year-old, that injured themselves. And if you want to extract bone marrow to help them heal, yeah, okay, that's fine. But if they're sick, they have chronic illness like autoimmune diseases, a lot of them have defective stem cells.
Right.
So you're gonna take out the defective cells to try to heal your disease, and that's it's not gonna work as well.
Okay. So let's talk a little bit about the different conditions that you treat with stem cells. Like one of the things people often will say, "Oh yeah, stem cells be it to avoid a knee replacement or to address joints and all that kind of stuff." But there's a lot of really interesting serious diseases, and you actually even mentioned like autism before, or someone who's had a massive heart attack and there's been damage to the cardiac muscle, or people who've had strokes or traumatic brain injuries, like, or I think we talked about earlier, MS or different types of diseases. And I've even heard about stem cells being used for autoimmune disease to kind of help the immune system come back online. So do you want to talk a little bit about some of these other scenarios where stem cells can be really impactful?
Yeah, yeah. And then that's a much better way of putting it, about stem cells being impactful, because
Yeah.
I have to tread very carefully about treating anybody with any diseases. So I can treat them, but I can't say I treat them with stem cells, because then I'm, equivalent to making a claim, then the FDA is going to knock on my door. So,
Interesting. Okay.
yeah, so I can't say I treat some condition with stem cells. I can say we can use stem cells to help you, do better, help
Okay.
you, maybe help you gain more function. So unless there's FDA approval, and so far FDA has only approved stem cell therapy for hemo reconstitution. So if somebody has hematological diseases or cancer, you wipe out their whole blood system and you want to replenish it, then you can use cord blood cells or bone marrow transplantation. So that's considered a indication. But other than that, everything is off label.
Really? Okay.
Yeah. So as far as different conditions that I've seen stem cell therapy have, brought about really huge changes in patients. Definitely autoimmune diseases, that's kind of the bread and butter for stem cell therapy, because they're so immune modulating
Yeah.
and they help reduce inflammation. They help, of course, tissue regeneration. So that's a huge area. And then musculoskeletal, all the sports injuries. I mean, that's how I think first became famous, right? All these athletes, getting, back into the game and, at pretty astounding rate or, extent. And then there's what I've seen is healing different organs. So helping with different organs recoveries that includes all kinds of heart diseases, liver conditions, and renal failure, and
So
I've
in
seen,
kidneys. Yeah.
yeah, yeah.
What about the pancreas for type 1 diabetes? Have you seen that it can be helpful there as well sometimes?
Yeah, absolutely.
Ish?
So yeah, there's been really good results showing good recovery for both type 1 and type 2 diabetes, even
Wow.
regenerating the beta cells that produces insulin. And it's pretty cool. And in one case, the beta cell actually, I guess the cells decided to become a islet cell and produce insulin, but in the liver. So that's okay. It's producing
Really?
insulin. Yeah, it's doing its thing, and so is the liver. Who cares? Yeah. So
That's
it's really
pretty
interesting.
fascinating though.
Yeah, yeah. So diabetes definitely, seeing it in sometimes strange conditions, right? Like I treated this one patient with testicular repeated swelling, infection, already got one testicle taken out, and now the doctor wants to remove the other one because the other one is acting the same way. So I gave him stem cell treatment, not knowing if it's going to help. This is experimental. Let's see. Let's see. The worst, is that it's going to help your other areas of your health
Mhm.
because of the way the cells work, rejuvenating effect. But let's see what happens. And then so I did, IV infusion, and within a couple months, the nodules in the testicles all disappeared, and it went back to its normal size
Wow.
and symptom free. So he's thrilled because
No
for
kidding.
almost 2 years, there's no quality of life, right? Swollen testicle, painful, throbbing, antibiotics on and off. So now it's healed. So it's pretty awesome. So I
Yeah.
see interesting cases, that no one has studied. Who's going to study testicular swelling, right? It's not a common condition.
No, so
So
nobody ever. But how much of that do you think is and how many of these things do you feel maybe it's about the immune system getting a reboot in some ways? Because so many, like I've spoken to a few practitioners now, and so many things can be, and things that you wouldn't imagine, but can be traced back to some kind of immune imbalance, or people have these underlying chronic infections that everybody thinks are dormant, but really they're kind of messing with the immune system, like the EBVs and, tick-borne viruses, like, I mean, tick-borne viruses, like so many people, they're like the walking wounded. These people can't function. Nobody can seem to help them. The immune system has gone completely haywire, either because it's confused or disabled, and who the heck knows anymore. But even in this case of the testicular swelling, like, is it possible that maybe it was an autoimmune thing, or there was an infection, and somehow these stem cells may have helped to breathe new life into the immune system, or reprogram the immune system, or rejuvenate somehow? What are your
yeah, it's very
this is
likely.
a
And
big fat theory. It means nothing, but
right.
just
Right, but again, these stem cells have so many mechanisms of actions, right? So one, it does modulate the immune system, so it can boost your immune system when you need it, or when you can calm down your immune system when it's overactive.
yeah.
And then it has the property of antifibrotic property, so it can break down scar tissue, on its own. That's one thing it can do. And it has antimicrobial properties, so it can directly help to secrete antimicrobial peptides and help kill bacteria and viruses. And it can also detect cancer cells and help kill off cancer cells. So there are many, because of the many ways that it can work. So there may be one problem with multiple prongs of
Yeah.
propagation of why it perpetuates, and then the stem cells can come in and address many things all at once.
That's so interesting. I recently had someone in my community ask me about, she'd been very, very ill and had had a lot of IV therapy. So she had a lot of scarring in her blood vessels. And she asked, she was asking, is there a peptide that can go after she was asking about GHK. And I was like, I don't know if GHK can retroactive. Like, I know GHK at the time of injury, there seems to be some evidence in animal studies that it may help to reduce scarring. But I'm like, I'm not so sure it can, after the fact, turn the clock back. But from what you're saying here, is it possible that with someone like that, if they had a systemic infusion of stem cells, that somehow those stem cells might be helpful in reducing some of that damage and fibrosis, I guess, in the blood vessels that's from the
Right. And I wouldn't have believed it if I didn't see it firsthand. So, and I've seen that happen with liver cirrhosis, right?
Wow.
Severe kind of, heartening, right? Fibrotic fibrosis type of disease, or even COPD, right? This is a fibrosing,
In the
heartening,
lungs. Yeah.
of your lungs, and how people are regaining lung function, getting rid of oxygen, getting rid of almost all the COPD drugs. I mean, this is reversal. This is, we're breaking down the scar tissue. We're letting the normal tissue to form. So yeah,
That's pretty
it's
magical. So tell me
sometimes,
about
yeah.
autistic children, because you said there are clinicians that are working with autism. And so again, I mean, this is another one where I've connected recently with a woman who speaks a lot about, I don't want to say it's all about this one thing, but the role that infections can play in triggering autism or driving autism in kids, or pandas or pans. Like, she talks about a bunch of different things with autistic children. The people that who've worked with autistic kids, is it just like infusion of stem cells that seems to have helped them? And you would think, like, with a child, they have all these stem cells, but yet something in the system has gone awry, or the system's overwhelmed somehow, and even their little kid stem cells can't kind of help. Do you have any sense of what might be going on there? And is it usually like systemic infusions? Like, I can't imagine anybody's injecting anything into anyone's brain, particularly.
Um, there has been some clinics that
Some?
would inject into the spinal canal.
Okay.
Yeah, I don't do that, but um, there are studies done on why stem cell therapy is helpful for autism. So one reason could be, the immune modulating properties, because we all know autism has a huge correlation with autoimmune diseases, however it's caused. But a lot
Yeah.
of them, the family members have autoimmune diseases. So, and we all know we live in a toxic environment, between, all the drugs we're given, since we're little,
Yeah.
and all the toxic, substances. There could be immune dysregulation, right? Gut disruption. So stem cells can help with repair of the tissue, including the gut, and it can help decrease inflammation that may be going on in the brain that's triggering all these abnormal behavior. And then modulate the immune system that's behind all this, that's perpetuating it.
That's amazing.
And also help with, some hypothesis is that autism also have low oxygen perfusion. So in their brain, there's, hypoxia going on. So the stem cells can help produce more blood vessels. So the angiogenesis properties of the stem cells can help supply more oxygen to their brain. So there are quite a few mechanisms that why this may help.
Yeah. It's amazing though, that, and almost everything that we've talked about, it comes down, there's a link back to immune modulation. There's a link back to managing inflammation. Very often there's some kind of, there's a possibility of some kind of microbial issue at play. It all seems to, very often it just seems to come down. As a matter of fact, this one practitioner and I think you might even know her, Amy Jaramillo, who I recently interviewed, talking about how atrial fibrillation there are clinical studies that show a direct link between Epstein-Barr virus and triggering atrial fibrillation in people. And so all these poor people end up with pacemakers, when really maybe someday medicine will get to the point where it doesn't think that if you had mono when you were a kid, it's no big deal. We don't need to do anything about it. We actually think that, that EBV, that virus that still lives in your body, needs to be addressed so that it can't continue to kind of create trouble and down the road create that kind of damage.
Right, exactly. And I've seen, Lyme disease, for example, stem cells being really helpful, really giving them the kind of the power, behind their ability to fight, including people who suffered for years from Lyme disease, and stem cells just, huge, give them this huge impetus to reverse the process and even reverse brain lesions, as shown on MRI. So it's
Wow.
pretty incredible. So yeah, because of the multiple layers of how the cells can help your body heal.
Yeah.
But for infections, I do think there, a lot of times you may need multiple, approaches.
Of course.
Yeah,
Yeah.
sometimes including antibiotics.
Yeah. No, I mean, there's not one thing, right? I mean, it just seems that this one thing can be a really nice starting point or a very powerful, again, it's handing the body a very powerful toolkit to use as it needs, kind of thing.
Yeah, and actually one of the pretty well-known doctor, who you have interviewed, had Lyme disease. And he's an expert in holistic medicine, peptides, and everything helped, quite a bit. But there were still issues of, very low energy, continued, unwanted weight, and just not being very productive because of low energy. And within, a few months, 2 months of using stem cells, all of a sudden, this doctor lost, I think 30 pounds because he had energy to go to work, go work out in the gym, and cholesterol went down from 300s back to normal. I mean, it's just drastic. So this is an expert who has used every modality you can think of. And then finally, the stem cells give the person the final, put everything together.
It brings it home.
Yeah, exactly.
Yeah, that's amazing. So when you're, so basically, what about someone who's basically not sick, right? Someone who's just getting on in years.
Right.
And saying, maybe it would be nice to get a little refresh kind of reboot, right? And we all know that disease builds over years and decades. So even though I could be walking around looking pretty darn healthy, I mean, if I do my labs, there's a little sign here, a little thing there, oh, your thyroid could be a bit better, your whatever. So as a preventative measure, what are your thoughts on doing like a stem cell treatment at that level? And I know there's a bunch of biohackers who've done this stuff already, like, the big guys like Ben Greenfield and Dave Asprey. I mean, imagine them getting hooked up to like giant bags of stem cells and God knows what else.
Almost every of the big biohacker guys have done stem cells. Yeah, so that's what I did it for myself, because I really don't have any major problems, but I wanted to stay young. I wanted to stay, at a level where I'm enjoying life, right? I don't really care about living for a very, very long time. I care about living a really, really good life. So I started just by knowing how the cells work. I just thought, I've got to put that in me, even though I'm not sick, but I don't need to be sick, for these cells to do the same thing for me, to reverse any of the inflammation I may have popping up, any little cancer cells I may have popping up, right? So that's what I've been doing. And I would say 25% of my patients actually are very healthy, and they just want to stay healthy. And that's, why they come to me usually every 3 to 6 months to do a stem cell infusion.
Nice. And so how many stem cells would a person typically get in that kind of situation? Or does it vary based on budget?
Okay. You're touching upon a subject that's a little bit in the controversy. Okay, I'll just give you the background.
Okay.
First of all, FDA has the idea that if you talk about the benefits of the cells, when you receive the cells, in the result of the metabolic activity of the cells, that makes the cell a drug. So go figure, just think about the rationale. So I don't know how that came about, but so you can attribute the benefits of cell therapy to the metabolic activity of the cells.
Okay.
If you do, okay, then you are basically using it as a drug. Then you have to have drug study. So, usually it takes about $2 billion to bring a drug to market, right? So just that out of the way. If you talk about your cells being alive, that automatically you're hinting that you're counting on the metabolic activity of the cells, right? Otherwise, why are they alive? So alive means they're metabolically active.
Right.
So that's why a lot of these tissue banks and labs are scared to even talk about their cells being alive.
Huh.
So
Interesting.
because some have gotten warning letters. So if you can't talk about your cells being alive, then you really shouldn't be talking about cell count, right? These are
Exactly.
live cells, cell count. So you're tying your own hands. So you're completely bound. What do you say? Unless you go slightly out of bound. So that's something that people don't understand. And there are also detractors of early birth tissue derived stem cells. So there are people who are in the camp, especially in the bone marrow camp, because that's the oldest kid on the block. There's a lot at stake. It's established treatment. It takes a lot to set up the equipment and get trained. Doctors pay a lot of money. So then all of a sudden you get everything set up. All these patients are coming to you for stem cell treatment, right? And then here you turn around, somebody else is using a made product from young cells. They just buy the cells. They don't have to go through all this training, all this equipment, and they just buy the cells and give it to patients. So there's a lot of emotional, psychological, imbalance going on. And so there are certain people in the field would be detractors, and they would test products. So how they're doing it, I don't know. Depending on how long the cells are sitting on the counter, how are they
so many
what they equipment, right? So then there's really, really one very loud voice in the space, but that voice is contaminating the space, making a lot of people asking questions. The question they ask is that I heard there are no live cells. So, okay, first of all our products have to go through third-party testing. There has to be live cells. That if tissue transplant, right? Any tissue, you don't give them dead tissue, right?
No, that would be necrotizing fashion. Like it would be bad.
Right? So
yeah,
these are FDA registered and inspected tissue banks. You don't give dead tissue to people, right? You're giving them live, viable tissue transplant. So reputable ones definitely would do third-party testing. And our product have gone through third-party testing and have shown viability, have shown live cells. But can I show those documents? No.
Not so much. Yeah.
So this is just, this is kind of a ridiculous, right? Here, I was excited about stem cell therapy. I got into the space because it's like, this is incredible. We can heal people. We can make people better. This is so fun, so exciting. It's like, what? I can't say what?
Yeah.
I can't do this. I can't do that. And now we've got people who are in the same field are trying to stab each other. And then because they're using big words, so a lot of people buy into what they're saying and are saying, well, you have cells that, you're injecting products that have no live cells. I was like, my question is, okay, how do you fight a lie? It's a lie because you have direct proof that it's not true. But the information is out there and it's being repeated and repeated and repeated. So that's the situation we're in.
Yeah, no kidding. So what about when people worry about, like they worry about, okay, I'm getting stem cells from another person, right? Is there any chance that I could possibly get a genetic disease from that person? Or, I mean, I think I know the answer to this, but I want you to explain to the audience, if we're getting placental cord blood or that kind of thing, is there, like, I know that these products are heavily screened, the donors are screened. And also it's about the material that's in there and the material that is not, in terms of safety of this product. Do you want to speak to that a little bit?
Yeah. The product we use goes through stricter screening than organ transplantation, because that's the standard I want our products to be upheld to. So we screen things that are not included in the requirement list, including Chagas, prion disease, Lyme disease, COVID. So all these are things that we've added because we want to make sure. First of all, when a baby is healthy, when you have a live, healthy birth, that's one of the best screening, that everything is pretty much normal. And then the mothers will go through, all the questionnaires to see if there's any genetic diseases that runs in the family. So if there's any, it's rejected. We're not going to take it.
Yeah.
And so the mother's healthy. It's a healthy pregnancy, and they have to be young, under age 30. So there's just multiple factors to make sure that these are going to be healthy, healthy babies. And that said, even if there's some off chance, there's some genetic condition that's in this baby, remember, very few cells actually stay in your body.
Right.
And even if they stay, they're not going to all of a sudden generate, this whole organ for you.
Yeah.
So the impact is going to be very, very small.
Got it. Makes perfect sense. Okay. So I think we've covered a lot of the things I wanted to cover. I want to talk a little bit about the skincare line, because it's so, it's one of those things for people who, either don't have they can't afford to go for stem cell infusions. They don't have access to this kind of thing. In a way, I feel like your skincare line, it's a little bit like, I don't know, it's a little bit like buying Chanel makeup when you can't buy the Chanel suit. Or something, right? Like, it's going to be great makeup. Well, I mean, I lied. I don't think it's going to be that great anyway. It's full of fragrance and crap, but whatever. You're getting the aura of and you're getting the quality and everything that's infused from that culture, if you will, is in that product. But your product, like I guess you got really stoked about this stuff at some point and said, okay, we can put this in skincare and actually make a difference for people. And you sent me one like amazing cream that I've been using. I've actually, because I'm getting to the point where I kind of want to make sure my face doesn't completely fall down. So the first thing I'm doing is I'm doing this cosmetic acupuncture. And so right after every acupuncture treatment, in addition to using the cream twice a day, I have her put, instead of the stuff that she was going to use, I'm like, no, you need to use this, because there's holes in my face right now and you've stimulated all this stuff. So this is what we need to put on.
Exactly.
But maybe, do you want to talk a little bit about
Yeah,
because it's a beautiful product, and I'm curious, like, there's Wharton's jelly in there, and there's, now
Peptides.
there's peptides, and we can talk a little bit about peptides, but maybe talk about that.
I mean, really, it was okay. I got into the stem cell space to heal people. So, I want people to, I want to help people with really difficult conditions, live a better life. The last thing I thought about was the face. I mean, I didn't care about it that much, to be honest. I want to help people to live young and rejuvenate from the inside out. But then I do realize, at least for myself, I would like to have a good, clean product. And so it was very selfish. It's like, how come I can't find any good ones? How come everything has junk in it? Everything has all these synthetic material, and even things that I thought were not, are all natural. That's what they claim, and still have all these synthetic components. So that's how I decided, what? I have on my hand access to some of the best ingredients possible, which include the Wharton's jelly, include, some amniotic membrane, extraction. And then if I can use that and then add peptides and then make this truly 100% natural product, nothing I'm putting in there, is synthetic, not even the preservatives. So that's how I created the product, with the birth tissue component, with the peptide blend, and then with all these natural herbs, powerful natural oils, antioxidants, prebiotics. So that's how, this came about. And of course, then I have, created the most beautiful product, and, I want everybody else to enjoy it. And now, I realize just how amazing it is. I even use that for microneedling. So actually, I had somebody who was working for me that actually first started it. And she said, "Oh my God, this is amazing. I did that, and then I did microneedling." So I tried it myself, and it's amazing. Is as good, if not better than the PRP treatment. So you just put a layer of the Chara Omni cream on, and you run your usual microneedling. It's amazing. So yeah,
I need to do that. Okay.
Yeah, please try it. It's so good. So that's how it came about. It's my being a stickler about having it as all natural, because of being in the anti-aging field and having been educated on all the detrimental problems of all these synthetic ingredients. I just don't want to put it on my face.
Yeah, no, it's so smart. And I'm going to warn people now, if you go to the Charomi website, you might look at the price of the product and go, holy crap, and kind of fall off your chair. But I think that it's not what you made a really good point, which is that one bottle of this product lasts you 3 months. And so when you break it down, number one, it averages down beautifully to a very affordable price. But number two, the other thing that you said to me, which I thought was really interesting, is you only need one thing. You don't need a cream for your cheeks and another one for your lips and another one for your eyes and one for near your ears and another one for this. Like you need
you don't need
a
separate toner because the toner's already built in. You don't need a serum because a serum, it's already in the product. You just all in one, and that's the beauty and convenience of it. And it's I think people, I appreciate simplicity. I think those multiple products is a way to open up your wallet. So I think it's just like a scheme.
Yeah. Oh, I don't know. I mean, there's some interesting, there's the retinols and stuff, but whatever. I mean, I have to say that I've been using it, well, ever since I got my hands on it, I've been using it twice a day. Some days if I go to the gym, so I'll put it on first thing in the morning before I go to the gym, and then I come home and I wash my face and I do it again. So
yeah.
There's days where I'll have 3 applications, and tonight I'm going to, take my niacin, and I'll probably wash my face before the niacin flush and then throw it on during the niacin flush so that, all those blood vessels are at the surface drinking it up.
That's right.
But it's
right. Yeah.
It's a beautiful product. And but so for the Wharton's jelly and the amniotic membrane products, those don't need to be refrigerated. Those are, and I will also say that the woman who's doing my cosmetic acupuncture, who's doing, she's in this space, she looked at she was very suspicious. She looked at the ingredient list, and within 3 minutes, she's like, oh my God, she put this in it. And oh my God, she put that in it. Like she was totally blown away by your ingredient list.
Yeah, that's awesome. No, it doesn't, because the cells are not alive.
Right.
So the cells have been lysed to release all these therapeutic components. So it's already, in the cream. So it's all kind of homogenized in the cream. So you don't need to refrigerate.
So it's almost like all the growth factors.
It's gonna you can keep it longer for sure.
If you what?
If you put in the refrigerator, the shelf life is going to be longer.
Well, I mean, I don't need it to have a longer shelf life. I'm just going to keep using it.
Right. Exactly.
I'm not storing it for anything. Okay. So what else do you want to, do you want to talk about peptides at all? I mean, we're going to wrap up pretty soon. We've been going for about an hour. I've kept you for a while. Do you want to talk at all about where peptides do fit in for you or have fit in? Because it seems to me like the stem cells, in as much as what we can say about them, are a bit of a master key, right?
Right.
It's a little bit of like the master key that the maid has at the hotel. She can open all the rooms with her one thing. But then there's peptides. And so do you still kind of bring peptides in occasionally, or at certain
I think about a couple of years ago, that's when I brought peptide in. Partially, I just love how elegant it is and how you can target specific things, right? If I'm helping somebody to heal, musculoskeletal injuries, I can give them the right peptides to speed that up. If somebody had brain issues, I can use those, for anxiety, depression, for cognition. So, sleep, further boosting immune system. And there's just so many things that you can give extra help for. So I love incorporating that. So one is a overall rejuvenation and, with intelligence to go to places where it's needed. Another one is that you can target specific issues and organs.
Got it. Yeah, no, that makes total sense. So they're kind of like they hone in on the specific issues. And also, I guess, for people, again, like people who can't get the stem cells. I mean, I've definitely seen peptides do pretty amazing work on their own. I mean, maybe it's not as deep or as transformative or as long lasting as if you had that stem cell introduction, like that kind of stem cell infusion first, but even on their own, peptides can sometimes do pretty amazing work.
Yeah, absolutely. That's why I'm really excited about it.
Yeah. Although I have to say that with the immune system, they often don't seem to be able to do the whole job, right? Like you're still almost too specific with different like thymosin alpha 1 with the Th1, not the Th, like it's even though they're modulatory, they're still in one direction or the other. Whereas it seems to me that it sounds like with the stem cells, you're going further upstream here. You're really kind of taking a more global approach to the immune system rather than just trying to hone in on one thing.
Yeah, I believe that's true.
Yeah. Okay, well, I'm thinking that maybe now is time to tell people where they can find your fabulousness.
So I practice in Los Angeles. Our clinic is called Uplift. So you actually see the sign behind. So
right above your
Uplift,
head.
the Y, Uplift Longevity Center. And the cream you can find on trialomni.com. And I think Natalie, you can offer the listeners a special code so they can get a discount.
I think we gave them, I think it's Nat 10, but it'll be in the show notes. I'm pretty sure. I'm trying to keep it simple these days and use the same one over and over again. So I don't get confused.
Yeah.
So
yeah, and then people can always find me on the on YouTube channel, which is I think very informative. Some of the lectures I've given in different conferences, and then a lot of just me educating people on different aspects about stem cell therapy. So little snippets, including what's the difference between what we're doing here versus what they're doing in Panama, right?
Yeah.
And what about other people's DNA in me? What's the ramification? What are the 3 stages healing in stem cell therapy? Because there are different stages that different things are happening. So they're just, different targets. So I think those that'll be a fun place for people to check things out.
And is that Dr. Joy Kong or is that
it's Joy
Uplift Longevity?
Kong MD? Yeah, they just look up Joy Kong MD and then find my channel. And then I also have a podcast, the Dr. Joy Kong podcast.
Yes, you do.
They can find it on Spotify, Apple Podcast. So I've invited Natalie to come on my podcast and had a great show. People are very inspired, very interested. So
I think they'll be pretty inspired by you too. And also on Instagram, you're Joy Kong MD, right?
Dr. _ Joy _ Kong.
Okay. Yeah. Dr. _ Joy. Amazing. Well, Dr. Joy Kong, thank you again 1,000 times for being here today, for taking the time to speak with me. I really appreciate it. It's I'm so happy that we met, and I'm looking forward to many more meetings and conversations.
Yes, me too. Thank you for the great questions and a good conversation. Yeah, I'm so glad that we're getting this information out to your audience.
Likewise. Thank you so much.